Hello everyone, welcome to Dr. Lee's Evidence-Based Integrated Medicine, a place where Asian wisdom meets modern science. I'm your host, Chi-chan. In this episode, I would like to share with you what I know about Omega-3. Nearly 10% of the US population is taking fish oil, and there's a lot of controversy surrounding the health benefits of Omega-3. I hope I can bring some clarity on this topic. Given the amount of content I plan to share, stay tuned for part 2, which will cover the evidence summary. So let's start with a story. 50 years ago, two scientists from Denmark embarked on a mission to unravel a mystery. Why did the Inuit population in Greenland, who consume a diet rich in fat with almost no vegetables, exhibit an astonishingly low risk of developing heart attacks? So they conduct blood tests on 130 Eskimos and discover that in comparison to Eskimos who live in Denmark, they exhibit significantly lower of all types of lipids. This phenomenon brought about another question. What kept their lipid panel so low? If not genetics, what was it? Was it diet or lifestyle? In 1976, they delved deeper into the fatty acid composition of the Eskimos' blood. For reference, that was a time when people believed that unsaturated fats, even including omega-6 found in corn oils, were beneficial for heart disease. So there were people who take tons of corn oils just to prevent heart attack at that time. While to their surprise, they observed that Eskimos have low levels of omega-6 fatty acid, which couldn't explain that reduced risk of heart attacks on this population. However, they uncovered the presence of two unknown polyunsaturated fatty acids in their blood. These two discovered compounds were later identified as EPA and DHA, and they were found to be 6 times more abundant in the Eskimos' blood compared to those in Denmark. Since then, the research in the field of omega-3 fatty acid experienced significant growth. Until 2021, there were nearly 40,000 publications on omega-3 in PubMed, reflecting the increasing interest and extensive exploration of the topic in scientific literature. So let's spend one slide to delve into some chemistry nomenclature. What is omega-3? To answer that question, we have to start with what is fatty acid. The structure of a fatty acid typically consists of a carboxyl group followed by a long hydrocarbon chain, just like a lasso. Polyunsaturated fatty acids refer to that in blood lasso, there are multiple double bonds within their hydrocarbon chain, just like knots on the lasso. Omega-3 fatty acids are a subgroup of polyunsaturated fatty acids that specifically indicate the presence of at least one double bond between the third and the fourth carbon atom. Both omega-3 and omega-6 are essential fatty acids, meaning that the human body cannot naturally produce them on its own and must obtain from external sources. In general, omega-3 fatty acids encompass different structures of fatty acids, and that include ALA, EPA, and DHA. These compounds are generally associated with anti-inflammatory properties, meaning that the chemical reactions or metabolites tend to have anti-inflammatory properties or have less inflammation. On the other hand, omega-6 fatty acids are more pro-inflammatory. This is not to say that omega-6 fatty acids are bad to human body. In fact, they also play a crucial role in our health. The most important concept I want to convey is the significance of maintaining a balance between omega-3 and omega-6 at a certain ratio. It's just like a balance of yin and yang. ALA and LA are considered parent fatty acids, as they can give rise to other fatty acids in the same group. However, it's important to know that ALA generally has low conversion rate to EPA and DHA, at 10 to 15% at best. So for many vegetarians, ALA is their primary source of omega-3. If the conversion is not optimal, they can experience omega-3 deficiency. What affects ALA conversion? There is a genetic component. Females can often convert ALA to DHA and EPA more efficiently than males. Hormones can also influence the conversion. During periods of stress, we tend to secrete more cortisol and adrenaline, which could potentially reduce the conversion rate. What is the optimal omega-3 to omega-6 ratio? Well, it's still not clear. It's not controversial, however. For the past 2,000 years, there have been an increased trend in the omega-6 to omega-3 ratio, and that ratio has accelerated in the last 100 years. This picture illustrates the omega-6 to omega-3 ratio in different populations in history. As you can see, during the Paleolithic era, when humans lived in caves, our diet consists more omega-3 than omega-6. A true Mediterranean diet typically maintains an omega-6 to omega-3 ratio at 1 to 2. In Japan currently, this ratio is 4, while in the United States currently, it is 16.74. Multiple experts suggest that the optimal ratio of omega-6 to omega-3 should be around 4 to 5 based on preclinical studies. Well, if that ratio is indeed correct, the US population has a long way to go. So what does omega-3 do? First of all, omega-3 is by nature a fatty acid. It can easily be integrated into cell membrane structures and affect cell development. For example, DHA played a vital role in the development of nerves and eyes, particularly the retina. Second, it can regulate various genetic expressions, leading to the suppression or upregulation of cellular pathways. For instance, it can suppress NF-kappa B, which is a transcription factor that regulates the immune response. Last, the metabolite of omega-3, such as resolvins, act as mediators of inflammatory response. So the big question is, how much omega-3 do we need? Well, there are some guidelines from the Institute of Medicine and Dietary Guidelines for Americans. According to the National Academy of Medicine, the adequate intake, which is AI, for ALA is 1.6 grams per day for males and 1.1 grams per day for females. It's important to know that AI here is used when there's insufficient evidence to establish an RDA, which is a recommended dietary allowance. It is also worth highlighting that there is no established daily reverse intake for EPA and DHA, which are the primary omega-3 fatty acids that we obtain from seafood or fish oil and are essential for our health. There's a growing call within the medical community to develop reference intake for EPA and DHA, particularly in pregnant women. The dietary guidelines for Americans provide recommendations regarding the source of omega-3 and omega-6 fatty acid. In the United States currently, a healthy lifestyle, including consuming 8 ounce equivalent of seafood per week and 5 ounce of nuts per week. So to break down this further, 8 ounce equivalent of seafood per week translate to approximately 2 servings, which is roughly equivalent to 2 palm-sized portions of fish per week. In terms of nuts, to simplify it, I would suggest to take 1 serving of nuts, seeds, or soy product into the diet. Again, just to summarize, it is 2 servings, which is equal to 2 ounce equivalent of seafood per week, and 1 serving of nuts, seeds, soy products per day. It's worth noting that Mediterranean-style diet, the recommendation for fish consumption is slightly higher at 4 servings per week. compared to 2 servings per week. For individuals following vegetarian diet, it's become crucial to optimize the intake of nuts, seeds, or soy products. I typically recommend to including 2 servings of nuts, seeds, soy products daily for vegetarians to ensure an adequate intake of essential nutrients like omega-3 fatty acids and proteins. Let's talk about food sources. The food sources for omega-3 including ALA, which is typically obtained from plants such as nuts and seeds. EPA and DHA are typically obtained from seafood. Let's talk about ALA first. Some good food sources of ALA including flaxseed, walnut, chia seeds, and soy products. Regarding oil products, those containing more than 50% of omega-3, including chia seed oil, perilla oil, and flaxseed oil. It's important to know that if you decide to take those oils to meet ALA requirement, it is advised not to use them for cooking. Polyunsaturated fatty acids, especially those with more double bonds, such as omega-3, can easily become unstable when exposed to heat, and may metabolize into substance detrimental to health after cooking. In my opinion, the best oil for cooking is olive oil, which is rich in monosaturated fatty acid. Okay, let's talk about fish. When it comes to consuming fish, the FDA has provided guidance in the forms of synopsis of fish consumption. As previously mentioned, it is advisable to consume 2 servings of fish per week, and we can choose those fish from the category of best choices. These best choice fish contain lower level of mercury and higher level of omega-3 fatty acid. For children, the recommended intake begins at 1 ounce at age of 2 and gradually increase to 4 ounces by the age of 11. Seafoods that are rich in omega-3 fatty acid are listed in this table. To simplify the choices, we often recommend the acronym of SMASH, which stands for salmon, mackerel, anchovies, sardines, and herrings. It's worth mentioning that from financial perspective, or if you live far away from the sea, canned sardines are actually a reasonable option. Okay, let's dive into more about how to assess our nutrition status. How can one determine if their body is deficient in omega-3? There are primarily 2 tests. One involves directly checking the ratio of omega-6 to omega-3 content in the blood. The other is to measure the omega-3 content within the red blood cells, which is theoretically more accurate since it reflects the omega-3 levels over the past few months. While the goal of omega-6 to omega-3 ratio or omega-3 index are still controversial, many experts suggest the omega-6 to omega-3 ratio should be around 4, and the omega-3 index should be around 8%, and we need more research on that. Notably, these 2 tests are not part of the routine laboratory assessments during the annual checkup. What are some adverse effects of omega-3? Most side effects are mild, and the discontinuation rate is less than 5% even at a high dose. Some mild side effects including fish burps and loose stools. In general, omega-3 should be taken with meals to improve bioavailability. That means to improve absorption. While the absorption is less ideal, some providers do suggest that patients who experience gut discomfort to take omega-3 before sleep to reduce gut discomfort. One of the biggest concerns is that omega-3 could potentially increase the risk of bleeding by affecting the platelet aggregation. While the evidence for this claim is relatively scarce, and for the reference, American Heart Association suggesting of taking omega-3 at 4 grams a day is actually a safe approach Overall, I would say the bleeding risk is minimal with taking the omega-3 at 1 to 2 grams per day. I do exercise caution when patient is at a really high risk for bleeding, such as taking multiple blood thinners or taking high dose omega-3 for a prolonged period of time. How about the mercury contamination? The consumerlab.com tests the commercial products in the market and found no mercury contamination. It is worth noting that fish meat compared to fish oil has a high risk for mercury contamination. Dietary supplements can interact with medications. So again, I will exercise caution when prescribing large dose omega-3 to patients who are taking multiple blood thinners. It's interesting to know that when patients are on high dose omega-3, I do recommend to them that they also take vitamin E. Omega-3 has a tendency to undergo peroxidation, which the metabolites could be harmful to the body. And vitamin E is needed in the body, which can help to attenuate this oxidative stress. So it is reasonable to add 400 units of vitamin E for every 1 to 2 grams of omega-3 if you are taking omega-3 for the long term. Lastly, the omega-6 supplements, such as evening primrose oil for neuropathic pain, can reduce omega-3 levels. So omega-6 and omega-3 counteract each other. So therefore, it's reasonable to increase omega-3 intake while taking the omega-6 supplements. Lastly, in terms of the products in omega-3, there are a few things I want to point out. There are two forms currently of omega-3 in the market. One is triglyceride, which is a natural form. It has a better absorption, but do have a low dose of EPA and DHA. The other form undergoes esterification, which is basically cleaves out the glycerol part. So by doing that, it produces a higher content or density of EPA and DHA per capsule. Also, the benefit including that it can preserve slightly longer and have more stable molecular structures. However, it could affect absorption. I do not have a specific preference for which form is better. I think it depends on the patient's gut tolerance or the reason for taking supplements. When you smell residuity, that means the omega-3 acid is peroxidized. In that kind of scenario, you probably should not take those pills because it's already peroxidized. But it's actually a good sign that we know that there is omega-3 in them. For vegetarians, there are omega-3 options available that are made from algae. They usually come in a small dose, and the doses are varied. Lastly, for people who continue to have a stomach discomfort while taking those pills, there are actually some products in the market that are enterocoated, where omega-3 will only be released in the small intestine. Let's conclude the introduction of omega-3, and in the next video, I will present to you the summary of the clinical evidence. Thank you for your attention today.